Hi, everyone. Here is a explanation of how to complete your skills checklist for the CRMA course. It's used for both 24-hour or 40-hour course. When you complete this, you are going to email it to me in PDF format, not an image, but a PDF format. You're going to email it to the email listed on our training page. Okay, so the top of the skills checklist, the yellow areas highlighted need to be completed, the date, the student's name, participant, and especially your evaluator. If you are doing this 24-hour course, you can utilize a CRMA with 1 year experience to do your actual in-facility MedPass. If you're doing the 40-hour course, you will need an RN. Their certificate or license will need to also be included in your PDF copy of the skills checklist that you emailed to me. So here's an example of how all of the 6 columns should be completed. You will need to give at least 6 meds to actual residents at your workplace. And so there's a column for each med. In the directions here, it will tell you that a check mark is used for completion or a D is used for discussion, as some items don't always come up during the course of a MedPass. So if you look in section A and B, those for the most part should all have check marks. You're always going to compare the MAR to the order before you even start your MedPass to make sure that you have orders are up to date. And you should always understand what types of orders. Routine orders are meds that are given every day at the same time. PRN orders are given as needed, as an example. Section B, you're always going to verify the instructions and parameters on the label. You're always checking the label for each medication you're giving 3 times. It's kind of like when you cross the street, you know, we were taught to look left, right, and left again. And it's the same thing with checking the label on a for each med you give. You check the MAR to the label to the MAR, and the MAR to the label 3 times. Okay. Number 4, prepare med for leave of absence that may not necessarily come up on your MedPass. If you look in the chapter 113 rules and regulations in level 4, section 7, there's a place in there that says a CRMA cannot package meds for more than 72 hours leave of absence. If your resident's going to leave the facility for longer than that, it needs to be handled by the supervisor, or maybe perhaps special package arrangements made with the pharmacy. Checking for expiration dates. Usually meds that are prescribed are taken before they have a chance to expire. Meds that are stock meds, like a big bottle of Tylenol in the cart that everyone can use as long as they have an order, those are the types of things that tend to expire before it all gets used up. You should also be checking the dates on your orders to make sure that your orders are up to date. Just because you have meds in the cart doesn't mean the order is up to date. Remember, it's kind of the 1-3-12 rule. Narcotics orders legally expire in 1 month, generally 3 months for psychotropic meds, unless otherwise written, and 12 months for everything else. Ordering and reordering medications for section C, that may not necessarily come up. That's definitely something you want to check with your supervisor to see what the procedure is. Transcribing orders onto a MAR, we did that here in class. That can all get checks. Identify approach to resident. You should always understand that before you're giving your meds to residents. Over on the right, section F, that can get a D if you don't have narcotics in your MedPass. But then section D, the storing meds, med storage and locked, those should all have checks. We always store all medications and they are stored properly and locked, kept locked. Double locked and refrigeration, that could get a D. Double locked are for narcotics. Refrigeration is for, certain antibiotics or maybe suppositories. Down at the bottom right, section H, vital signs, we covered that as best we can in class. You should definitely cover that again with your evaluator. And then the bottom section, section I for pharmacy deliveries, that's another one you definitely want to check with a supervisor to see what the procedures are for deliveries. Next page on the left, section J, standard precautions, that should all have checks. We don't want to touch people's meds. You can utilize the cap and a pill bottle or a spoon and gloves to handle people's pills. You don't want to be touching people's pills with bare hands. Antipsychotropics, which are for mind mood behavior that may not necessarily be part of your med pass, that could get a D. And then down to section L, compare a label with a MAR. That should, all those, the 1, 2, and 3 should all have checks. That's the checking the label 3 times. Kind of like crossing the street, you look left, right, left. It's kind of the same. Check the MAR to the label to the MAR, and the MAR to the label again for a 3rd time before you give each med. Section M, prepare meds. Counting generally is for narcotics. You may not have that. That could get a D. Scoring means you're cutting the pill in half. That would be a tablet that has a line etched through the middle of it. That is for if the resident has maybe a divided dose. So maybe the pill comes in 10 milligram form, but the order is for 5 milligrams, and the pill has a line etched in it. That could be cut in half. That would mean score, and you'll have a little pill cutting device in your med room. And then number 3, pour a pop. That's all should have checks. That's the checking the label 3 times. Number 4 and 5 and 6, those could get a D. Crushed meds have to have a crush order. Those are for folks with swallowing the issues or what's called dysphagia. Mixing liquids, although all pills can go in 1 cup, liquids should each go in a separate cup. And then number 6, measuring topical medications, topical for the skin, you may not have those. Section N, disposal of meds for narcotics or non-narcotics. That issue may not come up during your med pass, but you want to check in with your supervisor on the procedure for that one. Over on the top right, the 8 rights, that whole block should all get checks. The section O, the 1 through 8, those should all have checks. We're always reviewing the 1 through 6 rights on the label, the MAR, and the order, and we're always keeping in mind the 7th and 8th rights with every med we give. Down to section P, document med administration, 1 and 2, those should all have checks. Section Q, talking about defining med errors. You should talk with that with your supervisor, as that procedure is handled sometimes a little differently depending on the facility. And finally, down at the bottom, section R. Number 1 should all have checks. Oral pills, mostly you're going to have pills in your med pass. 2 and 3, you may not have eye, ear drops, or nose sprays. Over on the right, may not have vaginal or rectal suppositories or creams, or topical or inhalers. So those, if not, then those can get a D. Down at the bottom of the 2nd page, this yellow highlighted area, you, the participant, sign and date. Your RN or CRMA evaluator signs and dates, and then print their name as well. This final page, the 3rd page, is just a clarification on the asterisks in these itemized entries for with that, just an overall entry that says items marked with a D were discussed in class or during the med pass. So again, this whole thing is completed. This is an example of how your skills checklist should look. Sign and date, and then email back to me in PDF format along with a copy of your RN or CRMA license or certificate. The email is info@professionalhealthcaretraining.com, and you can find that on our CRMA main training page. Hope this helps. Thanks for watching.